Hello. Today I'm going to talk about myself as a teacher, so you have an understanding of who's teaching you. And in that context, have a conversation about the larger place that this field, psychedelic therapy, finds itself in right now, and where you as trainees may orient yourself. I may orient myself so that we have a sense of different perspectives and where I stand and where that may match or not with where you stand. So that's my intention of talking to you frankly and transparently about what is sometimes the elephant in the room in the world of psychedelic-assisted psychotherapy. So in order to do that, I'm going to talk about three hypothetical conceptual groups of people. The first group of people that I'm going to talk about is a broad collection of professionals that fall under what I'm going to put over here as modern Western medicine. So this includes doctors and other medical professionals, as well as psychotherapists that are trained in Western medically sanctioned, evidence-based psychotherapy modalities. And so those of us who've come out of this tradition, myself included, and are operating under scientifically minded Western framework. Over here, in opposition, so to speak, I'm going to put a very diverse group of people, and I'm going to roughly call this group shamanic healing, or shamanic healers. Now, the word shamanic is problematic for reasons that are out of the scope of this talk, but I am going to use it because we don't have a better one. So under this umbrella term would be healing methods that we would nowadays call shamanic or neo-shamanic. Sometimes providers in these traditions or lineages may language what they do under terms like energy healing or various forms of intuitive healing. Historically, in the ancient world, for example, we would often see these types of healing referred to as faith healing. But regardless, these are methods of healing that operate from a framework outside of the Western medical one. Now, I recognize that what I have done here is lumped together a group of people that in reality are incredibly diverse, that may not identify with each other, with being lumped under the term shamanic, may even contradict each other's beliefs. So this is a very diverse collection. And so for purposes of this discussion, we are going to oversimplify things, and we're going to talk about this group of people under Western medicine and this group of people under shamanic healing, sort of non-Western framework, because we have to call it something. And there's a third group of people that we're also going to talk about. And then my invitation to those of you who are watching is to place yourself in one of those three groups. And then we'll talk about what that would mean for how I teach and how that may resonate or not with you. So over here, Western medicine. Western medicine today operates under the ethos of science, the scientific method, evidence-based practice, meaning practicing methods or using medicines or treatments that have been validated by controlled trial studies and have the scientific support. Science does not take the position that these things over here are not real, but it does take the position that those things cannot be measured or studied and are not provable and are therefore outside the scope of Western medicine. Now, individual people in the Western medical world may have all kinds of individual views about these healing methods over here, but science as a whole doesn't take a position other than to say that we can't scientifically validate these things. Over here, for purposes of this discussion, I'm going to talk about this healing world and some things that we can say about it if we are calling it one category. I have a lot of experience in both of these worlds. So what I'm going to speak to is my experience, my lived experience and knowledge of both of these worlds from my point of view, recognizing that I'm speaking only for me. So if anything I say here doesn't resonate with you or doesn't match your truth, please feel free to discard it. Globally over here, the shamanic healing modalities, and there's a couple of points I'd like to make. One is there's usually a cosmology attached, so an understanding of the more than human world. There is often an understanding or prominence of the intuitive abilities of the healer or of their access to that non-ordinary world. And thirdly, there's what I'll call their methods. Now, this is obviously a broad group of interventions, but there's shamanic healing methods that I'm going to talk about that I think a lot of people that are in this group over here have in common. Now, under methods, what I want to highlight is that there is a long-standing worldwide group of lineages and wisdom traditions from multiple cultures that one can put in this category. And almost all of them have an appreciation for altered states in healing. Altered states can be achieved in a lot of ways, and we know this because our human history over time has revealed multiple strains of knowledge and multiple traditions using multiple kinds of altered states for transformation or healing. In the ancient world, this may have been called ecstatic states or mystical states, or we may think of them today as trance states. But there's a lot of ways that we can alter consciousness, and that has effects on our awareness, our processing, our perspective, and our physical bodies. So ways of inducing altered consciousness are many. You can get an altered state through fasting, through prolonged solitude in nature, through intentional use of pain, or sometimes fear, through sonic drivers or other kinds of rhythmic methods like repetitive sounds or motions. You can achieve altered states through breath work. All of these things are found in multiple cultures around the world going back for a very long time. So all of these ways of altering consciousness have long legacies. None of us in the modern world have invented any of these things. And I've probably left some out. But last on that list is psychedelics, or using substances or medicines to alter one's consciousness. Psychedelic or other medicines, if you look around the world from an anthropological point of view. We know this. So over here in the shamanic world, you have these spiritual or cosmology elements that a lot of people over here are not comfortable with. You have a lot of times an emphasis on the individual access to that of the provider or the intuitive abilities of the provider, which also I think Western medicine is less comfortable with. And then you have the methods that they use in healing, often involving altered states. And for purposes of our discussion here, we're obviously especially interested in altered states induced through psychedelic medicines. So we're at this interesting place with teaching psychedelic-assisted psychotherapy, where we are teaching it, and I am teaching it under the Western medical umbrella, from a Western standpoint, as a modern Western medical practitioner. I can do this because at this point, psychedelic psychotherapy is an evidence-based practice. Due to the hard work of a lot of researchers in the decades preceding us, especially back in the 50s and 60s, before many of the substances were made illegal, and then more recently, through a lot of the research that's been in the media. So at this point, we actually have data that psychedelics are both effective and safe, and so they now are evidence-based. And so I can, in good conscience, call this an evidence-based practice under a Western scientifically sanctioned stamp of approval. At the same time, when you are in the room with the client, that client is in an altered state, therefore not in the same reality as you. And you have just stepped off the cliff of what any of us were taught in school. At least I can certainly say, having gone through medical school and residency, that I was never really taught how to navigate altered states or altered states of my clients, other than to medicate them away if they were pathological. So how to actually use those states in a healing way is completely out of the scope of what I was taught in my educational background. But this camp of people over here have huge knowledge in that, and often knowledge that probably goes back, we think, to the dawn of humanity in various ways, but was lost to Western medicine when Western medicine had to become, historically over time, scientific. So we're at this interesting crossroads of these two worlds. And that's why I think it's really important to talk about this, because I'd like to talk to you about where I stand on that and then bring in some other elements as well. So the third camp of people that I think is relevant to this discussion is the psychedelic underground in this country and in other countries as well. So these are communities, lineages, and teachers who've been actually practicing psychedelic healing and psychedelic therapies or psychotherapies on the underground for decades. So the accumulative, can't say that word, wisdom and knowledge that's in that group of people, especially with regard to actual experience in doing this work on a day-to-day lived way, and the vast majority of clients that they've worked with compared to this world over here. So the people that teach psychedelic work in the underground know more than I do. And I've been both grateful and privileged to be able to learn from and be part of those communities. And a lot of that knowledge is not something that we're ever going to hear because of the illegality of the world in which it operates. So we have these three groups of people, and I'm going to put the psychedelic underground as the third group here. And the reason I'm saying all this is that I've learned from experience that most of you coming for training are from one of these three camps. Some of you may find yourself in two of these camps, but rarely in all three. And so I'd like to talk about my stance with regard to those three different groups of people and what I might be able to offer or not offer, depending on what your background is. So over here in the Western medical world, a lot of the paradigms that the research studies were designed around and the way that we think about evidence-based psychedelic-assisted psychotherapy protocols now were seated in knowledge and wisdom that came from either the shamanic world, especially the indigenous shamanic world, or the psychedelic underground. And so there has been crosstalk between this community and this community over time, and also between this community and this community over time. But there is especially a lot of cross-pollination or crosstalk between the shamanic community and the psychedelic underground. Those two groups of people have often mixed together, practiced more alongside each other, or may actually be sometimes the same people more often than you'll see that over here. Why am I saying this? One is that people who identify in this group and people who identify in this group often present with very different worldviews and frameworks around what it is that we're doing here, and may even, as individuals, position themselves in opposition to the other camp. And I would like to say about myself that I have spent 20 years or so training and learning in Western medicine, medical school and residency and practice. And I've spent the equivalent of that amount of time, that same 20 years, in very deep research study of and training in and practice of modalities over in this world. So my position is that these two branches of knowledge or ways of approaching psychedelic psychotherapy are not as incongruent as people in both camps sometimes assume. So if you are someone coming from the Western medical tradition and interested in a career in psychedelic-assisted psychotherapy or interested in doing this training, I would really encourage you to do so. And I think that we actually need more science-minded and evidence-based practitioners in this field. I value science. I value evidence-based practice in my own work. And I think that increasing scientifically measured parameters around efficacy and safety can only benefit this field. So I think that you will feel comfortable in this training because this training is taught from a Western medical viewpoint. One piece of advice that I would give those of you who are coming from that background is to keep an open mind, though, about the possibility that there are things about human healing that you may yet have to learn. Not because your medical background is wrong, but because there are things that medical education can't teach you. And when you are in the room with someone in an altered state that's experiencing another reality, you are going to encounter things that you're not really trained for in this tradition. But there is knowledge and information about in this tradition. And that doesn't mean that you have to be a practitioner over here or have those skill sets. It just means having an open mind that you may be in a position to be about to learn some things that you didn't know you would learn, frankly. And if you have that stance, if you have that curiosity, then I think that you would do well in this field, and I think you're very well positioned. What I would like to let you know is I am not suggesting that by practicing in the psychedelic world, you need to or even should adopt a shamanic way of thinking or operating. Cosmology over here, a spiritual framework for this work, and the role of the provider as intuitive or as tuned to that, those are not things that are necessary to do this work well. But I do think that you'll find that some understanding of shamanic methods, healing modalities, especially those working with altered states, are very valuable in this world. And those are things that I think you can gain an increased appreciation of, even under the umbrella of science and without stepping out of an evidence-based way of understanding treatment. That has been my journey. So one of the things that I often recommend to people that are in this position is to look into two different branches of scientific study and research that are available and that are evidence-based, and yet will act as a sort of conceptual bridge to understanding what some of these shamanic providers over here are doing. The first of those is placebo studies. I recommend taking a deep dive into the scientific literature on placebo studies. There's a lot of randomized controlled data. There's a whole field of research dedicated to this. We are used to thinking of the placebo effect as, a non-effect. A medicine that doesn't work is a placebo. But the placebo effect actually is our ability as humans to heal ourselves in a way that we don't really understand or know consciously how to control. We can heal ourselves without knowing how we do it if we are given the right context. Placebo studies have a lot to say about the context in which the placebo effect really works. What is the placebo effect? Just a very quick definition of that for these purposes. If you give two groups of people a medicine, for example, and you measure how much they get better, maybe the people who get the medicine, 70% of them get better. And the people who got the placebo, 40% of them get better. This is a scenario that's really common in medical research. So this one worked better than this one, but the placebo group got 40% better. Either 40% of them are better or 40% of their symptoms have improved. That's a lot of improvement. Therefore, what science does, because science has integrity around how they measure these things, is they say, well, this group over here that got 70% better, 40% of that was obviously the same placebo effect. Therefore, we can only say that 30% of this improvement over here is really attributable to our treatment or our medication. We focus over here in Western medical world on the 30%. And we say this medicine worked because these people got better 30% more than these people. What people who are interested in placebo studies do is they say, whoa, what about this 40% that got better in both groups? That's a lot of symptom improvement. So they look at what factors modulate that or manipulate that in a way so that you can take advantage of the placebo effect to make people get better more. And what they find is that there are two elements that have a really large effect in how people self-heal under the influence of the placebo effect. One is what you would call belief or faith in the treatment. And this is often conceptualized in a modern standpoint as trust or a sense of the validity of the treatment. Like, this feels valid to me and I trust it. that stance creates a certain openness and a certain frame of mind where people notice and track differently. And this has been documented. Another thing that is really impactful in how the placebo effect affects people, and I'm still talking science here, is elements of the setting or the context. It could be something like what the provider is wearing or the color the walls are painted in the waiting room. All these things have been parsed out. So there's a lot known about how the context, the setting that you're in, and the belief or the stance that you have about the provider or the treatment, even if that is unconscious to you, affects how much the placebo effect shows up or how much you essentially self-heal. So some of you might have noticed that this sounds strikingly familiar to this thing that we talk about in psychedelic medicine called set and setting. So what I would like to highlight is that these providers over here operating in the shamanic world have intuitively understood this for a long time. They have often thousands of years of history of cumulative trial and error in figuring out what works and doesn't work, and how to create a context, a mindset, and a setting that really induces the ability that we have to heal ourselves. This is often what we call ceremony, right? So ceremonial induced altered states, which have elements of hypnotic suggestion or auto-hypnosis. And so this brings me to the second category of Western medically sanctioned research that I recommend people do a deep dive into. And that is the study of clinical hypnosis, its history, and also its modern use in clinical settings. I was really fortunate early in my career, back in residency, to work with mentors that used hypnosis and various degrees of trance states, and to get some training in that early on. So I really early on got to witness the profound effects on the mind, the awareness, and the body of hypnotic altered states. And this is something that's been documented and studied a lot in controlled trials and has a lot of evidence base that can be researched. And I would suggest to you that this is also functionally a component of shamanic healing methods that these wisdom traditions have always understood and used. So if this over here feels too unscientific or feels a little hard to approach, I would suggest you do your own research into the data on placebo studies and on clinical hypnosis and draw your own conclusions or see what you think about it after you've spent enough time with it. Those are both areas of research that have influenced me over time and have helped me bridge these worlds, because when I have been in shamanic settings or contexts or trained with those healers, when they're working with altered states, I can see and understand what's happening from a frame of reference of having seen hypnotic altered states or understood what the placebo effect in Western medicine. That would be my recommendation if you are coming in as a Western person. And then, like I said earlier, just being open to and comfortable being present with people who are having experiences that are outside of a framework that you understand, and to just learn more about that as you go. I want to be clear that I don't think that you need to approach this from a spiritual cosmology or adopt that aspect of the shamanic world. That has not been my experience, and if that doesn't call to you, then that should not be part of your practice or your orientation either. If you are in this Western medical camp that I've been speaking to, and you are coming from a place, if you're honest with yourself, more opposed to this world, feel uncomfortable with all the elements of it, and you have an agenda that you're aware of to eliminate all of this and bring psychedelic therapy completely into the Western box, so to speak, then I would actually propose that I might not be the teacher for you. I find that stance a bit problematic, mostly because I think that trainees that come in with that, what I would call an agenda, are at a significant risk of, when they are actually in a treatment context with a client in the room on an altered state, of invalidating that person's experience or of not being able to align with it in a way that holds it in a good way, because you have to take a stance within yourself against it. So you may be better off with a different kind of teacher or someone who trains in a different way, and that is totally okay. There's a lot of different teachers out there. And the way I approach this and teach this is just one way. By no means the only one or even the best one. So that's people that identify as coming from here. Those of you who are coming into training already self-identifying as being in this world, already practicing in this world, or this being your worldview or where you position yourself, I think that this is also a really fruitful place to start with psychedelic-assisted psychotherapy. My advice to those of you who find yourselves here is this is also not going to be a 100% natural transition for you. One thing that will be maybe the journey that some of you will find yourselves on is an acceptance of moving psychedelic work into an evidence-based framework and a scientifically validated framework. Because I am someone that comes out of a medical and scientific frame myself, it is important to me that the way that I teach this comes from an evidence-based template so that I can say that what I'm teaching is evidence-based. That matters to me. I have spent 20 years studying shamanic healing in various ways. And I have a lot of experience, academic and book learning, and also experiential and training based in that world. But I did not practice psychedelic-assisted psychotherapy in my clinic until it was an evidence-based practice that I could use published literature to guide my protocols and how I implemented it and make sure that I was doing it in ways that had some data for efficacy and also for safety. So I don't approach this work from the standpoint of anything that intuitively feels okay is okay, or the intuitive guidance of the provider dictates the way that it goes. And I do know that that is very valid in this world, but that's not a piece that I bring in. The way that I teach is the framework, and anything that we can defer to the evidence base for, we do. And yet, one thing that we cannot get from the evidence base, which is the nuanced understanding of altered states and how to navigate them, I honor that wisdom coming from this world. I think if you are coming from the shamanic world and wanting to get trained and practice this, and you are in a position to do so in your career, working with me would probably be partly taking those skill sets and intuitive abilities that you've been working with and bringing them into the structure of something that I would consider evidence-based practice. Lastly, I'll speak to those of you who are already underground psychedelic providers, because I know that some of you are. Usually, in my experience, that is a smaller group, but consistently people that approach me that may be intending to move into a clinical practice in some way. That is pretty individual about where you're coming from and to what extent pieces that I teach may be valuable or not. I'll say, frankly, a lot of what might be valuable, if that's the world that you're coming from, is the pieces that are about ketamine itself as a medicine and how to move into working specifically with ketamine, the logistics of that, and so on. But other aspects of this training are probably things that you know about. So having said all of that, I want to reiterate that my personal experience is in all three of these worlds. And I feel really grateful for the fact that my life has given me those opportunities. And really grateful that it's allowed me to be better at doing this work in the way that I do it. And I also recognize that some of that is unique to me. And so I hope that all of you will check in with yourselves, take the parts of what I teach that's valuable, and then feel free to discard the parts that don't resonate with you. Because by no means, as I said before, do I think that the way that I do things is the right way. I also recognize that all these different strains of teaching and influences that I've had over time, many of them are seated in wisdom traditions that come from indigenous cultures, some of which are still living cultures today. And I, as a white woman, have no authority to speak for, and never will, for those cultures, though I recognize an indebtedness to them in more ways than I'm probably even aware in the teachers and the experiences that I've been privileged to be part of. I also understand as a white person who's been educated, had the path paved for me in a lot of ways, that I'm speaking from a position of privilege. Many BIPOC therapists are probably going to see in the way I teach a lot of blind spots that naturally come from the fact that as a white woman, I can never fully understand the lived experience of being non-white in this world right now. And though it is my job to try to understand that better, I know that I never really fully can understand it. And because of that, there's going to be blind spots or ways that I teach that I won't know, and that I do hope will be pointed out to me. All of that said, my more recent credentials in this field, having said everything about my background and my more global stance, I'm a graduate of the certificate program from the Center for Psychedelic Therapies and Research at the California Institute of Integral Studies. I have completed the available trainings through the Multidisciplinary Association for Psychedelic Studies, or MAPS, and I hold certification as a guide in ceremonial rites of passage, working with ceremonial, shamanic, or nature-based healing modalities through the Rites of Passage Council. I intend to teach this course from a Western medical standpoint, but I hope that I've helped you understand that I am very influenced by shamanic ways of teaching and operating. My own psychotherapy influences have been psychodynamic, cognitive behavioral therapies, which I incidentally would say work better with altered states than a lot of people think. Jungian, I have been influenced through self-study and mentoring in other therapies, including internal family systems and somatic forms of therapies like Hakomi and others. I think that is a good summary of my background and credentials. I invite you to reflect on that, see if that feels like a fit for you. And as always, check in with yourselves, what resonates with you and what doesn't. Thank you.